Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is 3klpm@gmail.com. Today we are going to talk about a very fascinating topic, the cover test. The cover test to understand the primary deviation and secondary deviation. So today we are going to talk about the cover test, cranial nerves part 32, oculomotor nerves part 18. Evaluation of the ocular misalignment diplopia objective test cover test. But to understand this, we need to understand the two laws pertaining to the primary deviation and secondary deviation. Primary deviation is the deviation of the abnormal eye muscle. Is the deviation of the muscle because of the abnormal eye movement. For example, if the right lateral rectus is weak, the medial rectus will overcome and will move medially. So this is primary deviation. This is based on Sherrington's law of reciprocal innervation. When agonists contract, antagonists have to relax. For example, when the right lateral rectus contracts, the medial rectus of the same eye has to relax. Then only the eye can move. If the right lateral rectus is paralyzed, the left medial rectus will overact and the eye moves medially. So the primary deviation is the deviation of the eye movement because of the weakness of a muscle pertaining to the same eye, one eye. So it's based on the Sherrington's law of reciprocal innervation. The secondary deviation is the deviation of the eye muscle in the healthy eye or the good eye. It is based on the Herring's law of equal and dual innervation. The secondary deviation is based on Herring's law of equal and dual innervation. According to this law, yoke muscles get equal innervation. For example, medial rectus of one eye and lateral rectus of the other eye get equal and dual innervation. And therefore, when I want to move the eye to one side, the medial rectus of one side and the lateral rectus on the other side contracts, they get equal innervation and eye moves smoothly. But imagine the left medial rectus were to get affected and does not move. The same innervation goes to the right lateral rectus. Now it moves mightily. There will be nystagmus. So the primary deviation is based on Sherrington's law of reciprocal innervation pertaining to the eye movement of one eye. The secondary deviation is based on Herring's law of equal and dual innervation pertaining to the eye movement of both the eyes. So having understood these principles, now we'll move forward. So objective test, cover test. A committance strabismus shows the same degree of deviation in all directions of gaze. Congenital non-paralytic strabismus is usually committant. That is, they are non-paralytic, usually seen in children. Whereas paralytic strabismus is likely to be seen in neurologic patients, is characterized by incommittance. The ocular malalignment as revealed by cover testing varies with the direction of the gaze and is greatest in the direction of action of the paralytic muscle. Paralytic strabismus. It is based on the principle secondary deviation is greater than the primary deviation. So paralytic strabismus is based on the principle secondary deviation is greater than the primary deviation. In paralytic strabismus, the affected eye will be deviated from the field of vision of the involved muscle. When a right cranial nerve 6th nerve palsy, with the right cranial nerve 6th nerve palsy, the right eye will be slightly abducted because it cannot abduct, it will be adducted. With equal vision in the two eyes, the non-involved left eye will fixate. So that in primary gaze, the left eye is fixating and the right eye is deviated towards the nose. This deviation of the right eye is called the primary deviation. If the target is moved into the field of action of the parietic muscle to the right eye, and the left eye is covered so that the right eye is forced to fixate, the left medial rectus, that is the yoke muscle of the right lateral rectus, will receive equal and simultaneous innervation per Herring's law. Because the right lateral rectus is trying mightily to contract in an attempt to fixate, the left medial rectus is simultaneously contract mightily under the cover. The left eye is markedly adducting into the right lateral gaze. Removal of the cover reveals deviation of the left eye, which is termed the secondary deviation. So, secondary deviation is always greater than the primary deviation. So, to summarize, the primary deviation is the deviation of the bad eye with the good eye fixating, and the secondary deviation is the deviation of the good eye with the bad eye fixating. In parietic strabismus, the secondary deviation is greater than the primary deviation. So, using these laws, Sherrington's law for eye movement abnormalities in a single eye and Herring's law of equal and dual innervation for abnormalities of eye movement in both eyes, we are able to find out the primary deviation because of the principle based on Sherrington's law, and secondary deviation because of the principle based on Herring's law, and that the secondary deviation is always greater than the primary deviation in parietic muscle. So using these laws and using these principles, we are able to find out the parietic strabismus and which eye muscle is involved. So these are the wonderful concepts of the cover test. I hope you have enjoyed listening to this video. Most of the important concepts of neurology, I have put it in a question and answer format in a book called Focused Neurology, written by me in a question and answer format, which will be useful for everyone. This book is available online from all leading booksellers, including Amazon, and therefore if interested, it could be bought online. If you have enjoyed listening to my video, please like and share the link to all your friends. But please subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.